Namaste बिटिया हमेशा खुश रहो बिटिया Today we are going to discuss with the tumors of myometrium and endometrium. Myself Dr. Arti, Associate Professor, Department of Pathology in Faculty of Homeopathic Sciences, JAYOTI VIDYAPEETH Women's University. In today's topic, we will start with the tumors arising from endometrium and myometrium may be benign or malignant. They may originate from different tissues as under endometrial glands, endometrium like endometrium polyp, endometrial carcinoma, from endometrial stroma like stromal nodules and stromal sarcoma, smooth muscles of the myometrium like leiomyoma and leiomyosarcomas, and Mullerian mesoderm that are mixed mesodermal or Mullerian tumors. Endometrial polyps. Uterine polyp is clinical term used for a polypoid growth projecting into the uterine lumen and may be composed of benign lesions or malignant polypoid tumors. The most common variety, however, is the one having the structure like that of endometrium and is termed endometrial or mucous polyp. They are more common in the perimenopausal age group. In general examination, there is an endometrial polyp, may be single or multiple, usually sessile and small, but occasionally they are large and pedunculated. In microscopic examination, they are essentially made up of mixture of endometrial gland and stroma. The histological pattern of the endometrial tissue in the polyp may resemble either functioning endometrium or hyperplastic endometrium of cystic hyperplasia type, the latter being more common. In endometrial carcinoma, carcinoma of the endometrium, commonly called uterine cancer, it is the most common pelvic malignancy in the females in the US and Eastern Europe, but in uncommon in Asia, where cervical cancer continues to be the leading cancer in the women. Increased frequency of the endometrial carcinoma in these countries may be due to longevity of the woman's life to develop their cancer of older females. The most important presenting complaint is abnormal bleeding in postmenopausal women or excessive flow in premenopausal years. What is the etiology? That is a first is a chronic unopposed estrogen excess. Second is obesity. Third is diabetes mellitus, hypertension, nulliparostate, and heredity. In pathogenesis, we'll see at molecular level it is examined as under endometrial hyperplasia is a forerunner of endometrioid cancer is supported by mutated PTEN gene located at the chromosome 10 seen in 20% cases of complex hyperplasia. Second is the papillary serous endometrial carcinoma is seen in the background of atrophic endometrium and it is associated with a mutation in P54 tumor suppression gene. Higher incidence in hereditary non-polyposis colon cancer HNPCC syndrome having simultaneous cancers of the colon and endometrial adenocarcinoma and in Cowden syndrome. In general examination, endometrial carcinoma may have two patterns. One is localized polypoid tumor or a diffuse tumor, the latter being more common. The tumor protrudes into the endometrial cavity as irregular, friable, and gray tan mass. Extension of the growth into the myometrium may be identified. In microscopic examination, the most endometrial carcinomas are adenocarcinomas, commonly termed endometrioid adenocarcinomas. Depending upon the pattern of the gland and individual cell changes, these may be well differentiated, moderately differentiated, and poorly differentiated. Papillary serous carcinoma of the endometrium resembling its ovarian counterpart in distinct sense it occurs in the background of atrophic endometrium and is more aggressive. In uncommon histological variant of endometrial carcinomas are adenocarcinoma with squamous metaplasia, adenocanthoma, adenosquamous carcinoma, when both components are frankly malignant clear cell carcinoma, mucinous adenocarcinoma, and papillary serous carcinoma. What is leiomyoma? Leiomyoma or fibromyoma, commonly called fibroid by the gynecologist, are the most common uterine tumor of the smooth muscle origin, often admixed with the variable amount of fibrous tissue component. About 20% of women above the age of 30 years harbor uterine myoma of varying size. Malignant transformation occurs less than 0.5% of the leiomyoma. Symptomatic cases may produce abnormal uterine bleeding, pain, symptom due to compression of the surrounding structures, and infertility. In morphologic features, the leiomyoma are frequently located in the uterus where they may occur within the myometrium, the serosa, or just underneath the endometrium. In general appearance, irrespective of their location, leiomyoma are often multiple, circumscribed, nodular, gray-white masses of variable size. On cut section, they exhibit characteristics bold pattern. In microscopic examination, they are essentially composed of two tissue elements, whole bundled of smooth muscle cell admixed with variable amount of connective tissue. The smooth muscle cells are uniform in size and shape with abundant cytoplasm and central oval nuclei. Now last is the leiomyosarcoma. Leiomyosarcoma is an uncommon malignant tumor as compared to its rather common being counterpart. The incidence of malignancy in pre-existing leiomyoma is less than 0.5%, but primary uterine sarcoma is less common than that which arises in the leiomyoma. The peak age incidence is seen in 4 to 6 decade of life. General examination show the tumor may form a diffuse, bulky, soft, flashy mass or polypoid mass projecting into the lumen. In microscopic examination, though there are usually some areas showing bold arrangement of spindle-shaped smooth muscle cells having large and hyperchromatic nuclei, the hallmark of diagnosis and prognosis is the number of mitosis per high power field. The essential diagnostic criteria are more than 10 mitos per 10 high power field with and without cellular atypia, or 5 to 10 mitos per 10 high power field with cellular atypia. More than number of the mitosis per 10 high power field, worse is the prognosis. That's all about the tumors of the endometrium and myometrium. This is my reference books, and I hope you enjoy this session. If you have any query, mention it in comment box. Thank you so much.